Well, the public health officials in this state predicted early on that we would see a disproportionate impact of this disease on communities of color and people with health conditions that were aggravated by financial inequities that they've faced throughout their lives. And the cases and the data they've come up with so far has borne that out. It's proven that to be true. And they're dedicating more efforts, focusing more on trying to even that out as they approach some of these outbreaks around the state.
We do know that people of color and Native Americans are experiencing multiple inequities in income, housing, employment, etc., that make them disproportionately susceptible to multiple health issues and chronic conditions.
Health Commissioner Jan Malcolm said while black Minnesotans are 6% of the state's population, they're 17% of all cases and 19% of hospitalizations for COVID-19. The Latinx Minnesotans are 5% of the population, but 14% of COVID cases, 9% of hospitalizations. Exposure is also higher because of the frontline jobs many work in.
We also know that Black and Latinx Minnesotans have increased exposure to the virus because of the higher rates of work in low-paying jobs that are now considered essential, such as childcare providers and grocers.
Now, Lieutenant Governor Flanagan is co-chairing a panel that's looking closely at these inequities and trying to find ways to try to make things better and then trying to apply what we know to these situations. Another thing that came up today during the Department of Health briefing is that the state is going to get a shipment from Health and Human Services of the drug remdesivir that has been doing well in helping shorten the hospital stays of people who have been hospitalized with COVID-19. They should be getting that, and they hope it'll be the first of many shipments to come to this state. Back to you.
All right, John, that is good news. Thank you.